Hello everyone, welcome to HW News. Now this is the 8th day of Unlock 1. Unlock 1 has been implemented in the country as a part of restoring normalcy in the country after almost 2 months of lockdown. In this video today, we are going to talk about the coronavirus updates that have happened today. Globally, coronavirus has infected 80,18,963 people and 4,36,138 people have died so far. In India, as of now, there are a total of 3,32,424 cases of coronavirus. 1,53,106 are active cases. 1,69,798 have either been cured, discharged or migrated, and 9,520 have died due to coronavirus. Up to 1.25 lakh tests were being done every day till 15 days ago in the country. At the same time, the number of testing has now increased to 1.5 lakh. In the last week of May, it was about 1.25 lakh tests that were being conducted every day. And in the first week of June, this was increased to 1.4 lakh, that is 1,40,000 tests were being conducted, and now the capacity has been increased to 1,50,000 every day. From the last 5 days, however, every day India is reporting 11,000 coronavirus cases. Today, India recorded 11,500 cases and 325 deaths in the last 24 hours. By the end of the June, the number of infected people could reach 5 lakh if this coronavirus cases graph progresses like this. The doubling rate is 17.4 days, which means every 17 days the corona cases in the country are doubling. Now, accordingly, by July 18, if this particular progress is considered, this number can be 10 lakhs, and in the first week of August, it could go up to 20 lakhs in the country. Let us now move on to important news of the day. Following a steep rise in the coronavirus cases, over the last few days, Tamil Nadu Chief Minister Edappadi K. Palaniswamy said that on Monday, Chennai and adjoining areas will be under lockdown from June 19 to June 30, sans present relaxation and a full-scale shutdown on 2 Sundays. The decision was taken after the Chief Minister held a meeting with a multidisciplinary medical committee that recommended the move in view of the coronavirus outbreak. The government announced a complete lockdown in Chennai and several areas that fall under the jurisdiction of Greater Chennai Police and situated in Tiruvallur, Chengalpet and Kanchipuram district from June 19 to June 30th. During the 12-day period, only essential services will be allowed with restrictions. Besides the full-scale shutdown without any relaxation on 2 Sundays, that is June 21 and June 28th. Essential services including grocery, vegetables, fruit shops, petrol pump stations will be open from 6 a.m. to 2 p.m. for the next 12 days beginning Thursday midnight. Tea shops would remain closed, and so would other standalone and neighborhood shops that do not fall in the essential category. Hotels will be allowed to continue services via parcels and deliveries from 6 a.m. to 8 p.m. Food delivery services will also remain open, but employees would have to carry their identity card. Now, let me remind you that Tamil Nadu is the second most affected state in the country due to coronavirus. Let us move on to next news. Union Home Minister Amit Shah, after chairing an all-party meeting earlier today, reviewed the coronavirus preparedness at Delhi's LNJP hospital, with the capital witnessing a daily increase in the number of infections. Amit Shah earlier told all political parties to put their differences aside and work unitedly for the benefit of the people. According to sources, Amit Shah's visit to the LNJP hospital comes after on Sunday, in a meeting with the Delhi Chief Minister, Delhi LG and others, it was decided that a team should visit the capital's hospital to take the stock of the situation. In the Sunday meeting, the Home Minister had said that he would take the lead and visit the LNJP hospital. Prime Minister Narendra Modi will also, on the other hand, hold a fresh round of consultation with the Chief Ministers on Tuesday and Wednesday on ways to check the spread of coronavirus as India exits the lockdown. Let us move on to next news. The study claiming that the peak of coronavirus pandemic in India has been delayed by the 8-week lockdown and may now arrive around mid-November has been refuted by none other than Indian Council of Medical Research, which said that the study does not reflect its official position. Well, ICMR tweeted that the news reports attributing this particular study to the agency are misleading. This refers to non-peer-reviewed modeling not carried out by ICMR and does not reflect the official position of the agency. The study was conducted by researchers from an operations research group which is constituted by ICMR according to the report by the PTI. The report quoted this study suggesting that the nationwide lockdown in the country shifted the peak of the pandemic by an estimated 34 to 76 days and helped bring down the numbers of infection by 69 to 97%, thereby allowing time for the healthcare system to ramp up the resources and the infrastructure. Let us now move on to next news. The Delhi government directs all laboratories and hospitals to work on their full potential and ramp up the COVID-19 testing capacity to meet the increased demand of processing samples. In an order issued on Sunday, Health Secretary Padmini Singla also called for processing the samples within a maximum of 48 hours. Health Minister Satyendra Jain, on the other hand, said that laboratory facilities under the center in the national capital are also being extended to the city government. He also asserted that Delhi was doing maximum testing earlier and it will continue to do more testing with whatever resources are at its disposal. Now, this particular development has come after the Supreme Court slammed the Delhi government for reduced testing, whereas two other cities including Mumbai and Chennai are ramping up the testing capacity. Meanwhile, Telangana government has also decided to reduce the testing price. Earlier the price was 4,500, but following the model of Maharashtra, which also reduced the testing price, Telangana has also decided to reduce the price, and now 2,200 is what the patients, the suspected coronavirus cases, have to pay if they want to get themselves tested. That's all for COVID-19 update today. For more news and updates, log on to www.hwnews.in.
हमारे घरों में भी बच्चे होते हैं जो हमसे प्यार दुलार की आस करते हैं।
हमारा भी जीवन साथी है जिसको हमारे ड्यूटी से घर आने का इंतजार होता है।
हमारे घर में भी एक बूढ़ी माँ है जिनके लिए आज भी हम ही आंखों के तारे हैं।
लेकिन हम हमारे घरों में नहीं हैं। आपकी सुरक्षा में कोई कसर न रहे, इसलिए हम अपने प्रियजनों से दूर हैं।
हम में से ही कुछ तो अब इतने दूर जा चुके हैं कि वो वापस अपने घरों को लौट भी नहीं पाएंगे।
हमें गर्व है कि हमारे कंधों पे मुंबई शहर के नागरिकों की सुरक्षा की जिम्मेदारी है। हमारे जज्बे और बलिदान को व्यर्थ न जाने दे। इस संकट के समय में आप घर पे रहे, सुरक्षित रहे।
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, well, subscribe to our YouTube channel.
हमारे घरों में भी बच्चे होते हैं जो हमसे प्यार दुलार की आस करते हैं।
हमारा भी जीवन साथी है जिसको हमारे ड्यूटी से घर आने का इंतजार होता है।
हमारे घर में भी एक बूढ़ी माँ है जिनके लिए आज भी हम ही आंखों के तारे हैं।
लेकिन हम हमारे घरों में नहीं हैं। आपकी सुरक्षा में कोई कसर न रहे, इसलिए हम अपने प्रियजनों से दूर है।
हम में से ही कुछ तो अब इतने दूर जा चुके हैं कि वो वापस अपने घरों को लौट भी नहीं पाएंगे।
हमें गर्व है कि हमारे कंधों पे मुंबई शहर के नागरिकों की सुरक्षा की जिम्मेदारी है। हमारे जज्बे और बलिदान को व्यर्थ न जाने दे। इस संकट के समय में आप घर पे रहे, सुरक्षित रहे।